Sorry for the interruption. Sorry for the interruption for a technical snag. So we are discussing about the how the snoring happens. Now let us see what are the tests we do to understand whether the snoring is a simple snoring or a dangerous snoring. See, dangerous snoring also technically medical terms we call it as obstructive sleep apnea. So what is the difference? In snoring, as we discussed earlier, there is a partial blockage of the breathing pipe. So, because of the partial blockage, there is sound. As well, the air entering into the lungs is also reduced. So, there is less oxygen in the blood. So, this less oxygen is going to affect the brain as well as the heart, because these two structures cannot tolerate low oxygen levels. Oxygen is very important for the brain as well as the heart, but still they manage. And this part of the snoring is acceptable. There is not much of risk to the heart and brain. When the oxygen reduction is more than 2% or 3%, then heart and brain going to have some suffering. And the next stage is there will be complete stoppage of the breathing. When the complete stoppage of breathing happens for more than 10 seconds, this is a dangerous thing. And during this 10 seconds, the individual will keep different kinds of efforts to breathe in, which will not be successful. And when such a thing happens, the brain gets up from the deeper sleep to the lighter sleep, and brain doesn't get the relaxation what it is supposed to get with the sleep. So a simple snoring is a is acceptable, and all individuals, most of them, do snore for around 30 to 60 minutes in a 6-hour sleep, and that is normal. But during this 30 to 60 minutes also, this period of snoring also, they will not lose the oxygenation. That means their oxygen concentration in the blood will not drop beyond 2 or 3%, and they don't stop the breathing completely for more than 10 seconds. So, this is a simple snoring. The next stage of snoring is called heroic snoring. What is this heroic snoring? Here, the same thing like the first stage, simple snoring, but here the sound is so loud it disturbs the people sleeping in the next room also. See, the other family members also get disturbed. In the simple snoring, the life partner gets disturbed, but sometimes they get used to it. They, they it's okay for them. But when it goes to the next room also, the other family members get disturbed. That is called heroic snoring. So even in this heroic snoring also, the individual who is snoring may not have any bad effects on the health. So this is the second stage. The third stage is called obstructive sleep apnea. In obstructive sleep apnea, what happens? The breathing is reduced. Not only that, breathing is stopped for a while, for more than 10 seconds. And during this 10 seconds, the oxygen saturation in the blood is dropped beyond 3%. It can be 5%, 10%, 20%, 50% also. As the oxygen saturation drops down, there will be more and more bad effects to the brain, heart, and lungs also. So, this is called obstructive sleep apnea. This is very dangerous. This has to be treated as early as possible, because sometimes during this complete stoppage of breathing, which is also called as apnea, the there will be a lot of disturbance to the heartbeat, and the heartbeat can go very rapid or can stop, and sometimes that can cause a sudden death. And if you look at, you might have seen somebody having a sudden death with an excellent health. If you look at them, most of them are obese, having more body weight, and they snore a lot. So one of the causes of sudden death in the night is obstructive sleep apnea, and this can be treated very easily, and this must be treated. So how to identify this obstructive sleep apnea? These patients will have, number one, they snore a lot. It is heard to the next room also, and they will have daytime sleepiness, and they have lethargy, means they don't, even after they get up they don't want to work anything, they don't want to take a correct decision in their profession. So this obstructive sleep apnea leads to professional and career loss also. They take, people say that they take a wrong decision in their business or in the profession. So obstructive sleep apnea has a lot of impact on the health as well as the profession of the individuals. So this is about the obstructive sleep apnea. Again, in the obstructive sleep apnea, we have three stages. This depends on the number of times an individual stops the breathing per hour. Like for example, if the individual stops the breathing or reduces the breathing to a critical level for less than 5 times, it is considered as normal. It is considered as a good sleep. But if it is beyond 5 times, 5 to 15, this is called a mild obstructive sleep apnea. 15 to 30 times is called moderate obstructive sleep apnea, and more than 30 times is called severe sleep apnea. When the sleep apnea is moderate or severe, it has to be treated as early as possible. Now, let us see. We have a question here. Mr. Sohel. Yeah, he he asked me this question yesterday also, because it's not about the sinusitis, we didn't answer it. He's asking about what is the different, what is the chronic and frontal sinus difference. Okay, the chronic sinusitis means the duration of the sinusitis is more than 45 days, more than 6 weeks is called chronic sinusitis. And the frontal sinus is a sinus which is in the front part of the head. It is above the eyes and in front of the brain. So in the forehead, in this area, the frontal sinus will be there. And when there is infection in the frontal sinus, this is called frontal sinusitis. And if it is for more than 6 weeks, this is called chronic frontal sinusitis. Most of the chronic frontal sinusitis patients will have heaviness in the head, nose block, nasal discharge, means running nose, and sometimes they have loss of smell. And another thing what they have is a phlegm coming into the throat from the back of the nose, and that goes into the voice box and can produce change in voice, and our vocal cord nodules or vocal polyps, and that can go to the ear and produce infections in the ear, that can go to the lungs, and that can cause repeated infections of the lung like bronchitis. And sometimes if it is severe, that can cause even a pneumonia also. So these are the issues of the chronic frontal sinusitis. Usually if it is less than 2 weeks duration, this is called acute sinusitis, and acute sinusitis with proper medication resolves completely most of the times, and this is the goal of medical treatment. And once it becomes chronic, more than 6 weeks, usually they don't respond very well to the medical treatment. Still, before the surgery, we try a good course of medical treatment, and if that fails, then usually they require surgery. So Most of the acute sinusitis, they respond to a good medical treatment. Most of the chronic sinusitis, they require surgical treatment. So I think I have answered Mr. Suhail. And then we'll go to the obstructive sleep apnea again. In the obstructive sleep apnea, so we discussed about the stages, and we discussed about the issues what happen in the obstructive sleep apnea, how it is developing. The next thing is why this happens. So where is the blockage of the breathing? So the breathing path from the nose, if you keep counting, nose and then back of the nose and back of the mouth, also called as oropharynx, and then the tongue, back of the tongue, and then epiglottis. So we have 5 levels of blockage, possible blockages. In the nose, if there is a blockage, that can cause obstructive sleep apnea. Sometimes even sinusitis also can cause obstructive sleep apnea because of the increased secretions in the back of the nose, in the nose, and blockage in the nasal breathing. The another common cause of obstructive sleep apnea is hypothyroidism. When the thyroid is functioning less, when the thyroid functioning is less, there will be some accumulation of fluid in the body, and that produces obstructive sleep apnea. So if the thyroid hormones are replaced, and immediately the obstructive sleep apnea gets corrected. So the next level of obstruction is after the nose is the back of the nose. Mostly it happens in children. The adenoids is the cause for the obstruction in the back of the nose. The next level of obstruction is the tonsil or oral oropharynx. If there is a big tonsil, there is a long uvula, long palate, and this also causes blockage of the breathing path and cause the obstructive sleep apnea. And the next one is the back of the tongue. Some people have bulky tongue, and that causes the obstructive sleep apnea. The last one is the epiglottis. When epiglottis is the cause for the obstructive sleep apnea, it has to be corrected by surgery only. The other blockages can be improved by a method called CPAP. And CPAP, the full form is continuous positive airway pressure mask. So when you use a CPAP machine, it comes as a mask, and you put this mask to the face, covering the nose and mouth, and you connect this to a small machine which pumps air into the lungs. So what happens, there will not be a much negative pressure, and that takes care of the collapse during the deep sleep. So that will not happen, and they will be able to have good breathing. But some people don't like to use this CPAP, or it may not be comfortable to them. In such situations, we do the surgery, and about the surgery, we'll discuss in one of the next Facebook Live. Thank you. ఏంటి వాళ్ళంతా